Hi everybody, welcome back to the Easy Dental channel. My name is Bogdan Bonica. I'm the principal dentist here at Easy Dental, and today we're going to have a little incursion into the world of dental implants. Some treatments that we do here at Easy Dental. We're going to try to cover all the aspects of dental implants here at Easy Dental. Go for different treatment options, try to explain as best as we can, as best as our ability. Try to go really deep into the conversation about our treatment options, and hopefully our patients will be a bit more informed about the options that they can benefit actually before coming to see us or to have a discussion, so they will know what to pick for. So the implants that we are using currently, they are called MIS. MIS stands for Make It Simple. It's an American company. It's part of the Dentsply group, which is a huge group, has a lot of other brands, well-known brands in the dental world. It's been around for many years. They know what they are doing. The implant system has been around since 1997. They have a lot of case studies behind them, so it's a very trustworthy company. And let's talk about why we need a dental implant. And if we can see on the next slide, so let's say we have a missing tooth. In this case, we have a missing lower first premolar. So if we have a missing tooth and we come to the decision of replacing that tooth, there are a few alternatives. We're not going to go through all the alternatives that are available, like for example, like a partial denture or a decent bridge or something like that. So we're going to just focus between the two main treatments. One will be a dental implant, so a single implant that will replace the root of your tooth, and then zirconia crown will come on top of that, will be cemented or screw retained. We'll talk later about the differences between the screw retained crowns and the cement retained crowns. And the crown comes, and basically this is what the patient sees. So when the patient looks in his mouth, we'll see this crown. This part is actually in the bone. The patient doesn't see it. It's more of the surgeon's concern how these things are looking from an aesthetic point of view, also radiologically. The most traditional approach, or before implants were brought to the market, to the dental market, the more conventional approach was to do a bridge, a conventional bridge. So that will involve preparation, filing down of your natural teeth, and then to have three crowns joined together that will create a bridge, hence the name, that will go on top of the gap of the existing gap where the tooth was lost, so where the tooth was missing. This bridge will be cemented. So what are the differences? Sometimes with these bridges you can find problems like the cementation. So the cement that holds this bridge in place can wear off, and you can lose the bridge. If this is the case, it's an easy procedure. Just go to your dentist and he can be able to re-cement that bridge back in place. Sometimes with these bridges, the problems that we might encounter will be the pulp necrosis of the abutments of the teeth that support the bridge. In that case, you'll need more complex procedure like a root canal treatment. So in time, the nerve of these teeth dies inside of the tooth, and the patient experiences some discomfort to pressure. Sometimes can get a bit worse, where the patient has like a swelling dental abscess. So therefore, rather than filing down two good teeth and potentially have some problems later on in life, it's better just to concentrate primarily only on the gap and fit a dental implant in that gap with a crown. So we discussed about the fact that this crown replicates the anatomy and the look, the shape and the color of your natural tooth. But what's inside the bone? What is this titanium roll that replicates the root of your tooth? We can see on the next slide that an implant is basically a thread. So it's an external thread with an internal connection, with another connection, with another thread inside. So the external thread engages into the bone. It also integrates in time. So in a matter of 3-4 months, it becomes part of the bone. And on top of the implant where this thread goes in, you can fit an abutment where you can fit that crown, and then you have a perfect restoration. Here at EasyDental, we deal with complex cases, but we deal with simple cases. So if you lost one of your teeth, we can help you regain that missing tooth by fitting you with a dental implant and a crown, and the mastication function, the phonetic function, the appearance, the aesthetics will be restored. But let's say that you've been neglecting your teeth for many years and unfortunately ended up in a situation where you lost most of your teeth, or most of your teeth are in a very bad situation, and you're gonna need to have what we call a full clearance. So basically you're gonna lose all your teeth on the arch, or potentially you already been through that process where you lost all your teeth from your arch and the dentist fitted you with a nice set of dentures. And we all know dentures can be a bit of a hassle. So sometimes when you go out, food gets trapped underneath, you need to take them out. If they are poor fit, you need to take them out. You need to be very careful with them. If you drop them on the floor, they can snap, they can fracture. And if you want a high-end quality denture or a very good fitting denture, you have to see a specialist, and that denture can go higher in price. So sometimes a good fitting denture or a chrome denture can be around the 2,000, 3,000 pounds margin. So bearing in mind that, let's see what options we have here at EasyDental. So on the next slide, we're gonna see that for our edentulous patients, we can fit them with locators. So what are the locators? The locators are these metal abutments that, as you can see, they have the thread, and the nice color purple, if you remember from the previous slide, that thread is corresponding to the implant. So this part of the abutment screws into our implant. So first you come and you have the dental implants fitted in your bone, in your jaw, and after a few months time, once things are healed and once the bone fuses to your implant, then you come back and we fit these abutments to your implants. And on the next slide, we'll see how things can look after 3-4 months of healing. So after 3-4 months of healing, in this situation, we have a case where we have 4 implants. So we have 4 implants equally displaced on the lower arch, and those implants were fitted with those locators. So those locators, they got screwed onto the implants. So now the situation is complete. We are ready for the next stage. The next stage, as we can see on the next slide, will be to have a model casted that will sort of replicate the exact position of the implants. This will be done either in surgery or with a dental lab. Here at EasyDental, we have our own dental lab on the premises, so we can do all these things in-house. We don't need external help. And on the next slide, we'll see that once we have our denture made, so this will be the inside of your denture, this will be a conventional denture. We have these metal housings with these rubber copings that will basically clip onto your implants. So it's a very secure option. So if you've been struggling for many years with Fixodent or Corega or other adhesive for dentures, C-Bond, for example, it's another very popular name. And if you're struggling with a Fixodent and you're thinking, okay, I need to have something a bit more secure, something that will allow me to go and enjoy life have a different approach to life where I can go out, enjoy a meal without the concern that I'm going to embarrass myself, that I have to run to the bathroom, to the toilet, and to refresh my amount of fixative just to enjoy the meal. If you're in that position, you can come over. We can fit you with the implants. We can have this denture made. We can pick the shade. We're gonna go for a few trials, and we can pick the shade and the shape of your teeth. And then with the help of these locators, we can have a very secure restoration in your mouth that you can benefit for many, many years. Obviously, we'll still need to see you for regular maintenance, but apart from that, everything should work perfectly, and you shouldn't need any more fixative forever in your life. Price for this treatment, it starts from £3,000, and I think the maximum for this case will be around the £4,000 margin. So this will be a removable situation. So as we discussed in the beginning of the video, we have different options for our patients here at Easy Dental. So this will be what we call a removable option on implants. So the implants are staying in your bone, but the teeth are removable. So the teeth can be removed. Also, this type of restoration is very good for patients who have or had periodontal disease. So obviously the periodontal disease where the teeth are becoming loose and you lose the teeth and you don't know why, the teeth are just flying out, that periodontal disease can affect also the implants long term. We have what we call the peri-implantitis situation. Also bad oral hygiene, poor maintenance of the implants. So in case if you lose one of your implants, let's say, the denture will still work on 3, and we can just move the implant to the left or to the right, so we can reposition the implant, and that will be without affecting the integrity of the denture too much, without damaging the way that you bite and the way that it functions. So we don't have to stop too much for just minding a small problem like losing one of your implants. So it's a very secure and a very reliable solution in case if you have no teeth, if you're experiencing the full denture scenario. Okay, so moving forward, we pretty much covered the situation where we have these dentures. A very important aspect of these dentures to function correctly is to have all the implants placed in a very parallel manner. So all the implants have to be parallel among themselves. So when you place the implants, usually we tend to rely on a surgical guide. The surgical guide will allow us to plan your implant placement, your implant surgery, before you actually sit in the chair. So what we have to do, you have to come to see us. We have to take some information like a CBCT scan, a 3D scan. We have to record, we have to take an impression or an intraoral scan of your mouth. And based on these two information, with the help of this software, we can digitally create a surgical guide that will help us position the implants in the best position from a surgical point of view. So where you have most of your bone and the best quality of your bone. Also, we don't have to worry too much about making sure that the implants are parallel, because the guide will eliminate this problem, because this guide has metal sleeves, and when we drill through the metal sleeves, it's a very small margin of error in achieving this fact in placing parallel implants. So again, this treatment is included in that price. So if you're happy to go ahead with the treatment, we can go again through the protocols and take all the details that we require in order to provide you with the surgical guide. And also this guide makes your surgery very easy and very easy to tolerate. Will only take around 30 to 40 minutes to place 4 implants. So it's quite fast, and the recovery for the patient is amazing. Patients who had this treatment, they experienced no pain or very little pain the next day after the surgery. And if we move ahead with our slideshow here, we can see that for a more of a permanent restoration, so now we're moving towards the fixed restorations. The fixed restorations will be something that only dentists with special interest in implants can help you with that. So we can fit them, we can remove them. So you can't remove them like the previous discussion, like the previous job that we presented, the one with the denture with the locators. That one you can remove safely at home and you can place it back yourself. This one requires the help of a dentist with special interest on implants. So how it works? Again, as you can see in this diagram, we have the implant. So the implant that will go in your bone, and threaded onto this implant, we have a multi-unit abutment. This multi-unit abutment will support a bar, a fixed bar that will connect among 4 or 5 or 6 implants, depending on how many we are planning to place in your case. And if we move ahead with the slideshow, we can present this kind of a bar that we do here at Easy Dental. This is a thimble bar. So what happens after a series of impressions and scans, we can achieve this titanium bar that will connect all your implants. This is a section through that bar. So the bar underneath is made of titanium, so it's quite rigid, quite strong. You can see the holes where the screws are going in. So it's a bar that's screwed directly onto your implants. That's why I was saying that nobody apart from us can remove this fixture. And then on top of this titanium, we have the porcelain teeth with a bit of pink porcelain in order to create a more suitable anatomy for our restoration. So again, on this side, you can notice the access cavities, the access channels for the screws that are going on to the implants. So this is a fixed restoration. This is, I will say, probably the best way to restore a patient that lost all his teeth. It's very secure, very natural, and easy to maintain as well. So just with the help of a water pick or interdental brushes, normal brush, you can provide a good oral hygiene. Also, we do recommend come and see us at least once a year, just to double check, to take some x-rays, make sure that the implants are still working fine. We don't have any problems or even signs of bone loss. It's very important to make sure that you're going to your annual or regular checks with your dentist to take some x-rays to make sure that you don't have any bone loss around your implants. So this would be probably the best treatment that here at Easy Dental we can provide for a dentures patient. So patients who lost all their teeth, this will be, let's say, the Rolls Royce of dental treatment to restore their dentition. Again, you can have different shapes, different shades, different colors on your teeth. So till you get to this setup, you'll go through a few trials to make sure that everything is fine. You bite correctly, you talk correctly, you don't develop a lisp and stuff like that. And obviously no discomfort, and generally you're happy with the result. A treatment like that will be in the region of 7,500 to 8,000 pounds per arch. So also the prices, you can find our prices on our website. And moving ahead with the treatments or with the design, we've seen some type of restorations. So patients who from financial reasons tend to go abroad, they go and they end up in this situation. We've seen many cases, patients who go to countries like Turkey, for example, they go in and they have this kind of treatment where the implants are placed into the bone, and then they have these metal abutments which are filed down very rough. They are sometimes prepared not by the technician, by the dentist in the patient's mouth, and then an impression is taken on top of that, and a bridge is made to fit. These bridges are not screw retained, so the bridge, you can see it comes in two parts. You have the metal abutments that screw onto your implants, and then you have that restoration that gets cemented on top of your abutments. We tend not to use this type of restorations anymore because obviously you can't have a very good and intimate contact between the porcelain and this material. I don't know if it's titanium, but it's very hard to achieve a good contact between the zirconia and that metal, let's say titanium for argument's sake. And also you have the cement that temporary cement usually that keeps this bridge in place. So problems that we encounter are as follow. Sometimes patients came in and the bridge came off. So because of the poor adaptation to the margins, the bridges, they are not very secure. So the bridges come off quite easily. And usually these bridges are cemented with temporary cement, just in case if something happens with the implants, you can remove the bridge and you can check what's going on with the implants. So usually these bridges are or should be cemented with temporary cement. So we've seen a lot of decementations from this kind of restorations. Obviously, if you had your treatment done abroad, your dentist probably will say who did the treatment has to take responsibility, and they will not be able to help you in respect to fitting your restoration. Sometimes what can happen will be these abutments, they have screws that secures them in place. One of the screws or two of the screws can come loose, and the bridge is still attached to these metal abutments, but the bridge itself feels loose because these metal abutments, the screws came loose and the whole thing starts to wobble. So the problem appears that if you try to remove the bridge, because these abutments are still engaged with the screw, if you try to pull too hard, you might snap the screw inside of the implant. Usually, what we did in the past for some patients trying to help them, we had to drill through the top of the bridge, basically to destroy the bridge, and aim to try to find this cavity in order to be able to tighten the screw. Sometimes in worst case scenarios, these abutments are coming loose and the patient bites something a bit harder and it tilts one of the abutments and the screw snaps inside. And if the screw snaps inside of your implant, sometimes it's very, very hard or pretty much impossible to remove that part of the screw that is strapped on your implant, and you might lose your implant and you might lose the bridge as well. So everything has to be done again. These bridges require a very good technician and a very good dentist. So, and everything has to be done to specifications. If you see the videos where most of the clinics are saying you come in, you have your implants done and your teeth extracted and your implants done in the first day, second day you stay, go enjoy the sun, third day you do this, fourth day you walk out with the temporary teeth, and in 4 months time you come back and you have your permanents fixed. It's rushed. I will say it's rushed. So from my experience treating many cases and many patients, we require a lot of time to make sure that everything fits correctly and we don't have problems long term. If everything is done in 4 days, you might regret it later on, and you might pay a lot of money to repair it later on. If you have your house and I'll come to you and I'll say, give me £5,000 and I'll paint your house in a day, you'll think I'm crazy. So it's roughly the same thing. You have to make, if you're thinking about traveling abroad to have your treatment done, you have to make sure that you get a lot of information from potential patients that have been to that practice and they are happy and they never had problems. We mostly seen these kind of restorations coming back from abroad. The screw retail restorations, they require a lot of components, which are quite expensive, and require a lot of time in the lab to make sure that everything fits perfectly. And those hours are obviously adding to the price of the treatment here in UK. So if something like this happen, where your bridge comes loose, don't be surprised if your dentist will say no when you ask him to help him, because he knows that if he's gonna start messing around with this bridge, he might end up in a situation where he might create more of an issue than it is. So the best thing to do is to contact the practice where you had the treatment done and go back to them and ask them to fix it. Your dentist, I don't think is going to be able, or is going to decline to help you in this matter. Okay, so moving ahead with what treatments we can do here at Easy Dental. Recently, or in the last few years, we have this new material that's coming from Spain, which is called the grafenano. So the grafenano, it's a polymer. It's a very high strength but very elastic material. And we successfully milled few restorations out of it. Crowns, those bars that I've showed you before. And we had some very good results, and the price is very competitive. And we thought to introduce it to our patients here at Easy Dental and to see what we can do about maybe helping these patients who have missing teeth, and let's say they would like to have something a bit fixed, but they can't really afford, the very expensive treatment with the titanium bar and the zirconia teeth and the porcelain and the layers and stuff like that. We'll try to find let's say, somewhere a middle alternative. Not the denture, because some of the patients, they prefer not to have something removable. They want something fixed as close as possible to their dentition. But they can't afford those premium teeth that we showed before. So, talking about this new material, the grafenano, and trying to help our patients, we are able to design a bar. So we have the grafenano. It's amazing because it comes in these natural veiny looking types of different shades of pink that can replicate your gum. And also we have the teeth on top, which are indeed very nice and look very natural. And this treatment, we are gonna promote it at £5,000 per arch. So if you want to get rid of your denture, you want something fixed, so fixed on 4 implants, this will be the option for £5,000. This will include the OD X-rays, the consultation, the CBCT scans, the surgical guide, the one that we discussed in order to place the implants accurately. The restoration will not include the pre-treatment. So in case if you have a lot of teeth to remove, if we need bone graft or stuff like that, and the temporary dentures or dentures that you're gonna need in the meantime till things are healing, those ones are gonna be a separate cost. But for the implants and the restoration on grafenano, you're looking around £5,000. If you decide to go ahead with this treatment, please contact us on the number below. Also check our website, and we'll be happy to see you, and we'll try to make your journey as smooth as possible.